Hello everyone, I am Dr. Asraful Azim, working as a Assistant Professor of Anatomy at Akij Medical College. Today I am going to talk about the parietal bone. So this is the parietal bone. Morphologically, this bone is a flat type. That means we can also call it squamous type. So as we know, in case of flat bone, we will found two table, inner table and outer table. This is the compact part of the bone, and inside and in between outer table and inner table there is a spongy bone, and we also called it diploid bone because of diploid vein present within this spongy part. And if we go to the parts of this bone, we will found this bone has 4 border and 2 surface. This is anterior border, this is superior border, this is posterior border, and this is inferior border, and this is external surface and internal surface. First of all, I would like to tell about the anatomical position of the bone. Before going to anatomical position of the bone, we have to know the parts of the bone. I already mentioned the surface and border, and we can also find the 4 angle. This is superior anterior superior angle, this is posterior superior angle, this is anterior inferior angle, and this is posterior inferior angle. And we will easily identify the anterior inferior angle as because of it is most projected angle among all the angles, and we will hold it in anatomical position. If we hold the angle in anterior inferior position, we can easily hold it in anatomical position. So this is the left parietal bone. Now I will discuss about the external surface of the bone, and this is convex outward, and a most prominent part is called parietal tuber. It is an important bony landmark as it is a projected part of this bone. We can measure the biparietal diameter by this point, and beneath this point an important structure is present beneath this parietal tuber. It is the sensory speech area of a brain, and we can also find the 2 line that is present in external outer surface. This is superior parietal line and inferior parietal line. In the superior parietal line, the temporal fascia is attached, and the inferior parietal line and the lower part of this bone attached with temporalis muscle. And if we see the inner surface, it is concave and marked with several linear depression. This depression is made by meningeal vessels. If we see the border of this bone, this is anterior border articulate with the frontal bone and from coronal suture. This is the superior border and articulate with the opposite parietal bone from the sagittal suture, and this is posterior border articulate with the superior lateral border of occipital bone and from the lambdoid suture, and this is the inferior border. It is articulate with the squamous part of temporal bone. If we consider the angles, this is the anterior inferior angle, and this angle 3 bone articulate at this angle. The squamous part of frontal bone, within the angle the greater ring of sphenoid, and behind the squamous part of temporal bone, and form a H-shaped suture, and it is called terion. And the posterior inferior angle, it is also known as asterion. This is a clinically important angle as because the inner aspect of this bone is marked by anterior of middle meningeal vessel. In direct violence, if the bone is injured, this vessel can injured and form intracranial hemorrhage. In the posterior inferior angle, the inner aspect of posterior inferior angle, there is a depression. It is from the part of sigmoid sulcus. The inner aspect of anterior inferior angle related with motor speech area of Broca. Inner aspect of superior sagittal border or superior border, there is a deep groove throughout the border. It is called superior sagittal sulcus, and within this sulcus the superior sinus is located. By the side of this sulcus there is lots of small bony pit that is formed due to accumulation of arachnoid villi that are responsible for CSF absorption. And during childhood, this anterior superior angle is articulate with 3 bones: the in front frontal bone and on its side, and behind the parietal bone, and this angle is called bregma. And the posterior superior angle, it is called lambda. And during childhood, all the angle is not from up to 2 years of life. It is before formation of this bone, it is covered by membrane. And if we consider the ossification of this bone, it is formed by membranous ossification, and as it is formed by membranous ossification, this 4 angle is about to fuse after birth, and it will require a long time after birth, near about around 2 years. The anterior superior angle is fused about 2 years of life, and within 1.5 years all the 3 angles will be ossified. Thank you. This is all about the parietal bone. I will discuss the frontal bone in my next video.